Okay, excellent. So, welcome everyone. This is week 2 classroom session. Um, this session is on forecast modeling and forecast accuracy. Unfortunately, again, Gilles would not be able to join us today. He is managing some family issues. Hopefully, he will be back next week. Hence, we have invited Mr. Pierre Dubesson. He is joining us from Paris, France. He's a senior supply chain consultant. He has worked with several global agencies like Global Fund, United. He works with Chemonics as a consultant for several countries. He's worked extensively in Francophone Africa. He's worked in Europe. He's worked in Canada in the private sector. So he has loads of private sector experience. And in the past half a decade or so, he has been working in the public health sector as well. So he will be joining us today. He will be taking part of the class as well. And he can also answer a lot of questions, for this session, because he is also the instructor for this entire course when we do it in French. And he's bilingual. He speaks a very good English, so he's helping us today with this session as well. So welcome, Pierre.
Thank you, Sanjay.
We will hear more from you in the second part of this session. Yeah? Okay, so maybe we can go next, Andrea. Okay, so before we begin this particular session, like always, let us just take a quick look. I'm going to switch off my video because my internet connection is not that good today. Okay, so let me take a quick look on week 1 assignment. So we have had several submissions on week 1 assignment. I'm just showing a few which were very good, although every assignment which have been submitted so far for week 1, they were quite good. I've also uploaded several on the group, on the virtual classroom group, so that everyone can look at them. Provided my comments on several of them, asked some more questions to people, like for example, Abdul's video of the supply chain in Benin was quite good. I asked him a question, he responded back, that was very good. I asked a question to Wilson as well. So on your screen, you would see some quite extensively shown supply chain designs with flow of product, money, and information. One from Zimbabwe, drawn by Wilson Chandomba, and the other from India for the state of Chhattisgarh. So India has 7 states, and this is for one of the states, which is drawn by Shraddha, who is also with us today. So you will see that in India it's a mixed situation where the federal ministry works together with the state ministry, and there is a share of responsibilities that is done at the state level, and there is some part of responsibilities done directly at the national level. Whereas in Zimbabwe, you will see a lot of the supply chain is coordinated amongst the Ministry of Health and Child Care, several donors and partners, and then centrally it is managed by NatFarm, National Pharmaceutical Company. And NatFarm coordinates with these organizations that procures the products based on the forecasting that they do, I think in collaboration with health facilities, clinics, and hospitals. And through their warehouse, they supply to the regional stores, from where the products flow to downstream health facilities and down to the patients. In Wilson's diagram, there was a bit of confusion about flow of money, which he explained more through a comment on the platform, which was very good. So where he said it's a mixed situation where part of it is user fee based, so patients have to pay for the products, but then there are several products where users don't pay, several program products, and then there is a fund which is being managed by UNICEF, through which patients also get a lot of products for either free of cost or at a highly subsidized rates. So that's for Zimbabwe. So similarly, there were some flows for Nigeria, which were drawn. There was one, like I said, drawn by Abdul for Benin. So similarly, I also would request everyone else who has not finished this assignment yet to quickly do it, so that they can move on to week 2. There are several learners who are already on week 2 who are going through the modules of product selection and quantification. In this today's session, Andrea, next slide. In today's session, we will look at forecasting, which is one of the activities in the quantification process. We will look at it in more details, and then we will also look at forecast accuracy. So how to understand if the forecasts that you have prepared, how accurate they are, how to understand that. So that would be the focus of today's session. Again, similarly, like the other sessions that you have participated in, we will look at some concepts. I hope everyone has received an Excel template working file. We will use that to look at various methods to do forecasts using different sets of data. There are some calculations involved which you should know the basic methodology for. So those things we will look at. There will be some polls and quizzes like every time. And then again, you can ask the questions whenever you want. You can raise your hands, or you can also write your questions in the chat. So again, let me quickly check. Has everyone received the Excel file? Just like Pierre is also asking on the chat. Abdul is saying yes, so I guess if Abdul has received it, then everyone else should have. If you have not seen it yet, then look at your emails. It should have come from Andrea. You can also simultaneously look at it while we also work on it in today's session. Next slide, please. So we'll begin this, with a quick poll for everyone. So Andrea, you can launch the poll. Just a quick question for everyone, that whether they find forecasting a difficult undertaking, a challenging task or not. There may be some people who have not developed forecasts yet, which is okay. But if you have done these activities, these processes in your organization, then do let us know whether you find it a difficult activity, or if you think that, oh, it's quite easy because you're quite good with calculations. Okay, Andrea, next slide, by the time people are going through the poll. All right, so as soon as if you see most people have answered, then you can show the results.
Yeah, we're waiting for a couple more, and then we'll end.
All right, so while Andrea launches the results, so you see on this slide, and this is also depicted in the course materials when you go into week 2, module 4 in the quantification module. So it's a mixed response. So some people have not done it yet. Some they find it quite easy, and some find it quite challenging. Okay, so it's a mixed bag. That's okay. We'll look at the forecast methodologies and processes equally for everyone, and maybe you would either learn something new today, or you will learn something that will supplement your current knowledge. Okay, so going back to this particular slide, so this is the detailed quantification process. So the objective of the quantification process is to understand for a particular period that you are doing the quantification for. Let's say if it is a 1 year or a 2 year process, 2 year period, Then for that 2-year period, what is the demand for, if you're doing it for a hospital, then what is the total demand of health commodities for that hospital for 2 years? If you're doing it for a country, for an entire country, what is the total demand? And we also include supply planning and quantification. That eventually, how do you want to get those supplies in what timelines, and which facilities want how much of products at what time eventually, and then in quantification, one of the key steps just after quantification you also do is to compare your demand against the allocated budget that you have. Okay. So eventually, after the quantification process, how much is that you need. Does that correspond to the budget that has been allocated to you? And when do you need those health commodities, in what timeline? Because you don't need everything at once, so you can stagger that supply based on the demand from different facilities, hospitals. So if you see these 4 steps, the first step is to understand the objectives of the program, or if it is essential medicines program, then what is the need and objectives of that. You can decide what kind of data is available. Based on that, what kind of forecast method you need, where will you collect the data from, and the quality of data. So you try to understand the methodology and try to collect the data. And step 2 is the forecasting. So this is what we will study today. So forecasting is to understand, based on certain assumptions and based on the data, what is the future need for the health products. And then, of course, based on the forecast, you do the supply plans. And then you also monitor your forecasts and supply plans based on actual data. So for anyone who's working in the departments where you are in charge of forecasting or in charge of quantification, your job does not end once you have developed the forecasts, or once you have developed your supply plans and handed it over to the procurement teams for procuring the products. Your job does not end. It's a cyclical process. You also need to collect the actual consumption data and keep on checking it against your forecasts to understand how accurate were the forecasts, and keep on reconciling your forecasts and your demand patterns accordingly. I think Wilson is saying he has some internet issues, so that's okay, Wilson. This session is being recorded, so in case you have any challenges today, you can also view it later when we post it on the group and the platform. Okay. So forecasting refers to predicting future events by carefully analyzing relevant strategies and plans, underlying assumptions and the environment, which is all the assumptions and strategies and plans we will study in this session. In health supply chains, it means to predict how much product quantity will be required to satisfy the health needs of the population at a future point in time. Okay, so the forecasting that you're doing, it's not being done for today, it's being done for a time point in future. So 6 months from today or 1 year from today, how much will you need in that period? So that is what forecasting is. Okay, so this is what we will study today. Next slide. Okay, so in the next segment, we will see different data sets that we can use to develop forecasts. But before we do that, we would like to ask you a question. This is a multiple response question. You can choose more than one response. The question is, select the data sets which can be used to develop forecasts. So you can select more than one data set, but we want to understand if you know which data sets you can use to develop forecasts for health commodities. Okay. So we can go to the next slide by the time So we are just you can bring everything on screen. Okay. Excellent. So we'll look at the responses for the quiz. But in today's exercise and in today's session, we will use 3 different sets of data. Okay. So the first one is consumption data. The second one is services data. The third one is morbidity data. The consumption data you can understand quite easily. That means the consumption of the product in history, historical consumption of the product. Okay. So very quickly, people have listed surveillance and services and consumption quite high. That's quite right. Yes, household data and adverse events data are not used to create forecasts. So the 3 right answers were services, surveillance, and consumption. Surveillance data, we can also call it morbidity data. Okay, so same kind of data. So like I was saying, so consumption data is the historical consumption of the product. So for example, number of vaccines administered at a facility. Consumption data must also correspond with the number of patients seen by the facility. So it should not be that the number of patients that is being seen at the facility and the doses which have been given to the patients, they should match. It should not be different. If it is different, then there is some issue either with the prescriptions or with the data management. Okay, so that's how you look at quality of data. Second is services data. Services data, we mean the number of patients or consumers that come to a health facility or a hospital. So like you see here, number of patients or consumers who visited the facility and got serviced. For example, 600 women were given oral contraceptive in the last quarter. 600 women visited the facility and received oral contraceptives in the last quarter. So that is the services data. Okay, so how many consumers or patients got serviced in a facility? The third is morbidity data. Morbidity data is collected to understand the magnitude of certain disease or illnesses in a population. For example, annual incidence rate for malaria for the district is 5%, which means that whatever the number of population in a district is, out of that 5% people can contract malaria every year. Okay, so morbidity tells us the prevalence of a disease. It does not relate to deaths. It relates to how many people can or will get sick because of a particular disease. Okay, so these are the 3 data sets that we will use today. We can go to the next slide. These are the 3 data sets that we will use today in today's exercise. For today's exercise, we will take a scenario, okay, a hypothetical scenario, and then we will use Excel, and we will use basic Excel calculations. Now, I'm saying basic because they are actually basic. But if you are not very good at Excel, you may find it a bit challenging. But don't worry, we're giving you that Excel sheet. We'll try to discuss all those calculations in today's session. It is always advisable for anyone who's working in supply chain to have a basic to intermediate Excel training from anywhere, whether it is local or through, anywhere in web. You can also watch YouTube videos to learn Excel. It's not that difficult. So we are not going to be using very, difficult or very, long Excel formulas. It will be very simple formulas and trying to link, different data sets to arrive at a forecast. But still, it is because it's a forecasting is a numerical game, so we have to use Excel. That is the most basic method of managing numbers. So forecasts can be developed using Excel, using more advanced programs. There are dedicated programs that you may be using in your countries to develop forecasts. UN have their own systems. Different organizations, different donors may come up with different forecasting softwares, but all of them, they work on these basic principles which we will discuss today. Okay. Now, this particular scenario, it's of district X. You can equate it with any district in your country, any province in your country, any small city, or any neighborhood. If in India, for example, this much population would be for a neighborhood, for example. So you can equate it with any of those. Now, in this particular district, it has a population of 200,000. Their growth rate is 3.2% annual. They have 5 sub-districts. They fully import their product needs. They have a, under the Ministry of Health, there is a national supply organization which supplies to this district directly. Okay, so these are the hypothetical scenarios and the data for district X. Next. So in the first scenario, you see the scenario here, and then we will go to the Excel sheet to discuss more. So we will be developing the forecast for a very simple product, which all of you may have heard. It's called ciprofloxacin. It's an antimicrobial product. It's in a tablet form, strength 500 milligrams. The pack size for a secondary pack is 100 tablets, organized in 10 tablets per strip. Okay, so it has 100 tablets in its secondary pack. Just always remember that whenever we prepare forecasts, eventually we would want to turn them into secondary packs so that it is easier to explain it to a supplier. Okay. The indication for this program is typhoid, diarrhea, infections for lower respiratory tract. So these are the indications of diseases where ciprofloxacin tablet is prescribed. It is part of the essential medicines program. There is no new program target. It is just required in a regular basis to treat these kind of indications. The funding is from Ministry of Health. The forecast period is 12 months. Now, our objective is to create the forecast for this product using a simple calculation of something called average monthly consumption. Okay, and probably you all have heard about it. Okay, so maybe we can go to the Excel sheet now, Andrea. Excellent. So if you see here, this is the first worksheet, and if you see on the tab, it says forecast 1. You see the same details of the product, ciprofloxacin, 100 tablets, 10 by 10 secondary pack, 12 months of forecast period. Okay, and district X has a growth rate of 3.2%. Whatever is in blue in this sheet, that is the data that has been already provided to us. Okay, so we have a period between January 2017 to December 2018. We have a period of 24 months, and we have monthly consumption in number of tablets. So for example, in January 2017, in district X, all facilities combined, they consumed 8,245 tablets. And similarly, if you look at all the months, by December 2018, in that particular month, they consumed 8,934 tablets. With, if you total everything, and if you go to the total cell, which is 213,903, the cell B38.
Yeah, 2001. Yeah, 213,903.
Yeah, go to that. Yes, exactly. So we are using a simple sum formula here. Sum of cells B13 to B36. You get 213,903 tablets. Now, like I said, we want to do our calculations in a pack format. So we know that in one secondary pack, we have 100 tablets. So to understand how much of the packs that were dispensed, we just divide the number of tablets by 100. So if you go to any of the C cell, C13 probably. Yeah, so if you see in the formula over there, it says B13 divided by 100. So if we divide B13 by 100, we get the number of packs. And then we also do a sum of all these packs. So in those 24 months, 2,139 packs were dispensed in district X. Now our objective does anyone want to say anything? Is it Pay? You want to say
yes, yes, Sanjay, sorry to interrupt you. I think you need to show here and to say that, so by divided for January 2017 by divided by 8,244 by 100, you go on 82. Now it should be rounded up.
Yeah, we can do round up as well, exactly. So it's not rounded up, we can also do round up. It's a simple formula. So if you put round up in front of B13, Andrea, if you go to the formula, on 82, go to 82. In the formula bar, on top, in the formula bar, just go in front of B13. Write round up. Bracket on, and in the end, bracket off. Comma. So after 100, comma. I think it's you put probably
2.
Probably.
Okay.
I think 1.
No, 1.
1. Yeah. So now
yes.
It does round up 83, and you can just drag it down. So we just rounded it up so that it is good to have more than less, slightly more than less. Okay. So rather than 2139, we now have 2140 packs. So just 1 pack additional here, not too much of a difference. Okay. So this is the data that we have. Now, what we need to do, we need to create a forecast for the next 12 months using a calculation of average monthly consumption. So if we go slightly on the right, so there is the formula for average monthly consumption written on top, which is sum of quantities consumed during the past period divided by the number of period. It's actually period, it's not period. So you can just quickly correct that. So the sum of quantities, we already know it is 2140, which we calculated by summing up the number of packs used in those 24 months, which is 2140. The period is 24 months. Okay, so the AMC, average monthly consumption, becomes 2140 divided by 24. That is 89. If you see on this yellow highlighted portion, which is 89. Okay. There are a lot of places where they would calculate average monthly consumption just by dividing like 3 months of data. I mean, although it still gives you average monthly consumption, but since the representative data, the number is so small, it's not really representative. Okay, things can change after those 3 months, and your average monthly consumption can differ really extensively. So it's always advisable to take slightly more, a bit more sample size, at least 12 months. That would be a very good sample size. If you can take more than 12 months, that would be excellent. And more specifically for products which are used in essential medicines program, because things can change every month for those products. For example, if you take example of ciprofloxacin, this is an antimicrobial. For some months, you may have a diarrhea outbreak. Some months, if you have some specific infections for lower respiratory tract, that may be accentuated in a particular month. Now, if you're taking average monthly consumption data for the months preceding those particular months where the infections are accentuated, then your calculations will be off later. Okay, so you at least need to take at least 12 months of data where you have some representations of some fluctuations. You can have some fluctuations of maybe some seasonal variations. So it is always advisable to take more sample size other than using 3 months of data, 6 months of data. Okay, so that is one quick thought here. Now, we said here in the assumptions initially that there is a growth rate of 3.2%. So the population size for the next year, there will be more people. Okay, so whenever we are creating forecasts, we take some logical assumptions. So it may not be entirely true that there will be 3.2% more patients who will need this product, but it's an assumption. Okay, so what we will do is we will just add to our AMC. Now, if you go to the cell which is highlighted 92, yeah. So if you see on the formula bar, we've just added 3.2% more packs into this AMC, just so that, you know, we kind of manage it for the increase in population which has been given to us. It is, you may not want to take that as well, you know, based on some policies that you may have in your country, in your organization. This is just an assumption. Now in forecasts, whenever you take an assumption, you write that down, that this is an assumption that has been taken for this particular forecast. Okay, so that whoever is looking at the data later on, or whether someone asks you in a a few months later that why did you increase your forecast if your average monthly consumption was this much, so you can tell them that okay, this is the assumption we took because of these certain reasons, and that's why we arrived at a slightly higher AMC. So now after adjusting our AMC, which is 92, if we need to create a forecast for 12 months, then what we need to do is simply multiply our adjusted average monthly consumption by 12, which is 12 months. So we are saying that on average, historically looking, we are consuming 89 packs. For future, there may be a slight increase in population. So we say that on average, we may be consuming 92 packs every month. So that for 12 months, you would need 92 multiplied by 12, which is 1,104 packs. So that is the forecast. Very simple, simple formula for AMC. We arrived at this forecast of 1,104 packs, which is the forecast for 12 months. Okay, we can go back to the slide and probably have just one more slide very quickly. Yes, and then maybe we can do a bit of Q&A. Now, AMC calculations are useful when we are doing a forecasting at a health facility. Okay, so if at a health facility you want to do forecasting for your products, AMC could be a very useful calculation because it's simple. You can do it for a lot of commodities at once, and you can add some assumptions and scenarios as well. It would be useful if you're trying to calculate months of stock available at a facility or a warehouse. So you know how much you are consuming per month. You know how much product is still available in your facility or a warehouse. So if you have all the units in packs, and if you divide the amount of product that is remaining in your facility or a warehouse by your average monthly consumption, your answer would be the time, which is the month. So you would know that your product at a facility is remaining for X number of months, like 3 months or 6 months. So you can order your products accordingly. So you know that the lead time for products to arrive from your higher warehouse or wherever the products come from is 2 months. Then you would place your orders for the products when they are at the 2.5 months level in your facility or warehouse. You also use AMC when consumption is mostly steady, like I said before, for essential medicines where consumptions can be steady. You can also take a look at some variations over a long period. You know that this is not going to fluctuate too much. So that's when your AMC is most useful. I mean, you can still use AMC for programs, for any other, where you have consumption data available, but most useful for these scenarios. Okay, next slide. So as we go to the poll, I also open the floor for any questions, any clarifications that you may need. You know, just checking if the poll is live. I guess it is. So there is a poll which is, have you used AMC calculations to prepare forecasts? Yes or no? As the poll is ongoing, if you have any clarifications for this first scenario where we used AMC to calculate forecasts, please you can ask those questions. And if you want to put any comment, that would be also a good time. And then you can show the results. Yeah, so most of you, I was very sure most of you have used AMC in your forecast, in your life before. If there is any comments so far, please don't hesitate to speak up. I'm sure you have used AMC before, so this is quite easy to understand. So it may not have a lot of questions. If not, then we can go to the next scenario. You can keep following, keep up with us using the Excel sheet. I believe all of you have access to it. So whenever we are on a new scenario, go to that specific sheet, and you can look at what are the formula we have been using. You can also add new formulas if you want to, use it for other scenarios. You can also, use the same formulas and create your own scenarios with the products that you are using in your facilities. Okay, but of course, in this one by one product by one, but there is a way to also consolidate this in a larger sheet where you have more than one product. You can also do it for 50, 100, 200 products at once. So now scenario 2. So in scenario 2, we will be using services data. Like we saw earlier, we're going to be using 3 sets of data today: consumption, services, and morbidity. So in the first scenario, we used consumption data. So we used the consumption of ciprofloxacin acid in the first scenario. Now in second scenario, the product is medroxyprogesterone injection acetate, 150 milligram. Now this is a product substitution scenario. So, and I'm sure this must have happened in your countries at some point in time. I mean, this has happened almost in all countries now, where this injection is being given to women as a contraceptive in place of oral contraceptives, because this has shown more efficacy, this has shown more promise, and you don't need to take the oral contraceptives. I mean, so you don't need to take this injection as often as you would take the oral contraceptives for women. So this injection, it comes in a pack, secondary pack, which has 24 pre-filled syringes. Okay, so one pack has 24 syringes. So which means, okay, so let's not go there. So now the treatment regimen, or the regimen for using this mode of contraception, is that one injection is needed every 3 months. Okay, so here we would introduce one concept which you will also read in your learning materials when you go through module 4, which is called CYP. Okay, so I'll come to that very quickly. So one injection is needed every 3 months. This is part of family planning program. There is a program target as well. Like I said, this is a product substitution. This is a new product, and there is a directive from the Ministry of Health, and with UNFPA, there is a new program target that, since this is a more effective product, 50 to 60% of women who were previously on oral contraceptives, they have to be substituted to this new way of contraception. Okay, so rather than giving them oral contraceptives, the health facilities and the clinicians now must prescribe this new injectable contraceptive to women. At least 60% of women existing users of oral contraceptives should be now substituted to this particular product. Okay, again, the forecast period is 12 months. We need to create the forecast using services data. Now, before we move on to the scenario, like I said, there's a new concept, there's a new term that everyone should know, which is called CYP. We go to the next slide. Next slide. Yes. CYP is a couple year of protection. In this case, couple means a husband and wife, can be partners. So if you see on the screen, couple years of protection is a measure that estimates the protection from pregnancy provided by contraceptive methods during a 1 year period, which means that whatever contraceptive method that you're using, how much of that would be needed in a year to prevent pregnancy. Okay, so for example, if women are using oral contraceptives, then 15 pill cycles would be needed. So oral contraceptives, when they are prescribed, they're prescribed in a format of pill cycle. Okay, the reason they don't prescribe in months or in tablets is because of the menstruation cycle in women, which is 28 days. So that's why they call it in cycles. So 15 pill cycles are used, and that is number 15 is the CYP factor when we are talking about oral contraceptives. Similarly, if we talk about condoms, then it is estimated then that 120 condoms are needed in a year. Okay, so the CYP factor for condoms is 120. Now, similarly, if we and if we go back to the previous slide, so if you see here, I said that one injection is needed every 3 months. So what do you think would be the CYP factor for medroxyprogesterone injection? The length of CYP, Abdul, is 1 year, 365 days, 1 year. Okay, so any guesses? You can say it on chat or you can unmute yourself.
I think the CYP factor for this injection is 4 times.
Yes, absolutely. Okay, so if one injection is needed every 3 months, then 4 injections are needed in a year. So 4 becomes the CYP factor for this product. Now we can go to the Excel. Excellent. So now we are in the second sheet. Slightly increasing the size. Yes, slightly more. Yeah, that's okay. I hope it's visible to everyone. If not, do let us know. The same data set is on your screen. Product name, pack size, forecast period. Again, district X, 200,000 people. Growth rate 3.2%. But now here, if you see, there's a new data set which says okay, I'm trying to access the screen, Andrea. Not really. Okay, that's okay. So in this exercise, there is a new data set that is women aged between 15 to 49. So 60,000 women are there in district X who are in the age of 15 to 49. And I'm sure that all of you have guessed why we are taking this number and not all women. Is because of the fertility in women is between 15 to 49 years of age. Okay, so that's why we're taking that number for our calculations here. Now, if you see the data here, this is the services data. It says number of women who attended clinics for oral contraceptive, and in the bracket you see unique. So which means new patients every time. So we're not counting one patient who came every month more than once. So in January, there were 1,256 unique women or unique patients or unique consumers, unique women who came to the clinic and joined on the oral contraceptive program. Similarly, in December, 3,000 women came to the clinic and joined in the oral contraceptive program. Okay, and of course, there may be some, okay, let me not go there, that would be a question for you later. So, so this way, we can calculate that in a period of 12 months, how many women attended clinics and joined the oral contraceptive program. Okay. Now, we need to use this data and create a forecast for a new product. Now, if you see here, in this data set, we are not talking about medroxyprogesterone. We're talking about the oral contraceptive. Okay, but the forecast that we have to create is for medroxyprogesterone. This product is not currently being used in the clinic. This is a new product. So let's see how we can do that. So the first thing is to understand the total number of women who visited the facilities for oral contraceptive. Now, this is simple. We do the sum of all the women who attended the clinics for oral contraceptive. So the sum function is being used. So we have 25,116 women who attended the clinics for the oral contraceptives. Now, as you saw before, we have a program target that 60% of existing women has to be transitioned to the new product. Okay, so we take this program target. Okay, that's 60% of 25,000. Okay, so 15,000 women has to be transitioned to the new product. There is no choice. Then if you, and just like to go up. Yeah, it says program target. If you read the program target again, that since it is proven more effective, the directive from MOH is to transition 50 to 60% of women on oral contraceptive to this regimen. That is a target, and there has to be some advocacy in the district as well. You know, so like you know, putting it on radio, putting it on newspaper. If it is a rural area, then probably sending some someone with mics, you know, announcing that in the village, flyers or posters. So some advocacy in the districts. Okay, so we are taking an assumption that in the facilities, at least 60% of women will be transitioned to the new contraceptive, and based on the advocacy efforts, there will be 10% new users. So users, women who were not using any contraceptives before, probably because they thought that, you know, it's not very easy to take pills every day or in that cycle. Now that they see that they only have to take 4 injections in a year, there will be more users, more women who would now adopt contraception. So we're taking an assumption again. This is an assumption, it's not a reality. But we can do that to create a forecast. So the assumption is 10% new users. So if you see the calculation, there are 60,000 women existing today. So 10% of 60,000 is 6,000. Okay. So for the first year, when we are supplying this new product, we may have 21,070 women, okay, who would need this new product of medroxyprogesterone. Now we know that each woman would need 4 injections in a year. So then the calculation becomes quite simple. If we go to N30, multiplying 21,000 women that we calculated that may adopt the new contraceptive by 4. So we need 84,280 injections. Now again, we want to calculate our forecast in number of packs. So we can divide this number by 24. And again, if you see here, we already used the roundup formula. So we are rounding it up again. It's always better to slightly use the higher number than the lower one. So we need 3,512 packs of injections, each pack having 24 injections. Okay. Now, if you slightly go down, Andrea, there's a question for everyone. Can we take any other assumption? So anyone can speak, or they can also write in the chat. Can we take any other assumption to create this forecast? Anyone? The peer, you are the instructor. You are not supposed to say that. You already know this. I guess someone wanted to speak. They had
Sorry.
Abdul.
Hello. Hello. Hello.
Yes, Abdul, go on.
Yeah. Thank you very much. Thank you for your presentation. First of all, I would like to understand something about the CYP. On one of your slides, I saw that the CYP is according to the method that is what to be used. Okay, the pills and the condom use. So, the one we are using now, is it according to the pills or another method?
Okay, so Abdul, CYP depends. It varies with the product. Okay, so the pills is a different product. Condom is a different product. Medroxyprogesterone is an injectable. It's a different product altogether. So that's why the CYP is different. If there is any other product, there are some other contraceptives like implants, for example. There are some implants which women can use once in 1 year, for example. So they only need one. The CYP factor will become 1 because they only need one implant in 1 year. Okay, there are implants which are long lasting. They stay for, let's say, 3 years. So then the CYP factor is even lower. That probably is 0.3. Okay, so 0.3 of that contraceptive is needed in 1 year. Similarly, medroxyprogesterone, we need 4 injections in 1 year. So that means the CYP factor, so that the couple, that particular couple, the husband and wife, they are prevented from pregnancy in a year, you need 4 injections. So the CYP factor becomes 4. Is it more clear now?
Yeah, it's clear. It's clear.
Okay.
It's
yeah.
Clear. Thank you.
Any other question? Or an answer to the question that we have asked?
Yes, I have a question.
Okay, but Henrik, please go on.
Yeah, my question is, do you think we should take into account the percentage for WIS?
Okay, can you please say that again?
Wastage percentage.
Wastage percentage.
Yes.
Yeah, that's a very good assumption. You can do it at this stage, or you can also do it in the supply planning stage. You can take your assumption either in this stage, or you can do it later. Generally, we don't take it in this stage because here we're trying to understand the demand. Okay, here our objective is to understand demand. Forecasting is simply to understand demand. From here, when we go to the next step, which is planning for your supply, that's when we try to understand if we have some stock on hand, what is the wastage, what is the safety stock we need. So then we add those things on top. Okay, what we are trying to do here in forecasting is just to understand the demand for that product for that particular year of particular time of 1 year. Okay, so that's why we're not taking wastage here. Wastage we will take in the next step, which is supply plan. Any response to this question? That any other assumptions that we can take? Pierre has already mentioned one, which is women who are lost to follow up. Okay, this is a very good assumption that whenever we're talking about oral contraceptives program, there will be some women who will be lost to follow up, which means that some women will come enroll in the program, but they may not come every month, or they may come for a few months and then they don't come back. So then the way we do this is, first of all, we need to figure out in our historical data that what is the percentage of women that can be lost to follow up. Okay, then we use that percentage in our forecast to adjust our demand, because we know that these many women will be lost to follow up. So we don't need, let's say that's 100 women, for example, then we do not need 400 injections. That we can deduct from our calculations. Anyone else want to speak? I think someone's mic is on. Here you want to speak, I guess.
No, that's okay.
Yeah. Any other assumptions? We have some women here as well. Any other assumption? Do you think there's one more very good assumption that we can take here, looking at the data set? Just pause for a few seconds. Okay, nothing coming to mind. Okay, so if you see in the data, we have the current data for women between the age of 15 and 49. So next year, there will be some more women who will come into this age bracket. Isn't that correct? Right? So we know that the growth rate is 3.2%. Now, we don't know how many women will come to that age. You can just take an assumption that since the growth rate is 3.2%, we believe that 3.2% more women out of the women we already have 60,000 can come to the fertile age, where they may also need contraception. So that's an assumption that you can take, to add on to your number of consumers for the next year. Okay, so that's another assumption. Okay, any other assumption that we can take? Otherwise, then we'll move to the next segment of session. All right. So now, when we are doing when we are developing forecasts using services data, or in this particular scenario as well, there are some challenges. Number one, there is no consumption data, since this is a new product. So we don't have any consumption data. We can't develop the forecast using consumption data. So we have to use services data. Okay. There is also no supply data. There are certain places where supply data or issue data is used as a proxy to consumption data. In this case, since it is a new product, we don't have any of these data. Neither do we have issue data, nor do we have consumption data. So we have to use services data in this context, and it's a new product. The other way of doing it is we call it proxy consumption. Proxy consumption, we do it like this, that, okay, if there was a district Y, let's take an example that there was a district Y in that particular country who have already adopted this new contraception. The population of district Y is very similar to district X. The conditions are also quite similar to district X. So if, let's say, they have consumption data of 6 months, for example, district X could have used that consumption data as proxy to their forecast. But again, there will be a very high rate of error into that data, because that's data from a different district altogether, and the culture may be different. Their advocacy efforts may be different. So it will be always advisable to take a data which is more relevant to the place where you're doing the forecast, developing the forecast. Okay. So these are the two scenarios that we studied with two different sets of data. One is consumption, second is services. Now there are two more scenarios in today's session, and then we also have another section on forecast accuracy. And now I invite Pierre to go through scenario 3 and 4 and also take us through forecast accuracy. So Pierre, over to you.
Thank you, Sanjay. I hope you hear me well.
Yes.
Can you hear me well?
We hear you.
Okay, excellent. So the reason why I take over here is Sanjay's skills in Excel is limited. So that's just kidding. we are increasing the complexity of the scenarios and the usage of Excel. So that's the reason why that's the thinking path. So the scenario number 3 is a combination of two molecules, artemether and lumefantrine, 20 milligram and 120 milligrams. So here the pack size is a bit tricky in this scenario number 3 because there's 4 pack sizes, and the indication is for malaria, and it's a very simple regimen because it's a 3-day regimen, but it depends on age. So again, you see how it becomes a bit more complex, and we would like you to be trained to this kind of complexity. The program is, of course, the National Malaria Program. It's a substitution treatment, and everyone should be put on this AL. And because the Global Fund is treating 3 diseases, this is the Global Fund financing this product. The forecast period is 12 months, and the demographic is the number of children between 0 and 3 years. There's 18,000 of these. Between 3 to 8, 25,000 of these, and then 8 to 12 years old, which is 6,700. So here we'll be using 2 types of data, the demographics and the surveillance data. Next slide, please. So we go back to the Excel spreadsheet and we go to the tab number 3. So we start by trying to understand, which is the first table, depending on the age, what are the number and the weight, what are the number of pills. So age 0 to 3, which is up to 15 kilograms, we need 6 pills in total for day 1, 2, and 3, 12 pills for age 3 to 8-year-old. And then the next one is 8 to 12 is 18 pills, and for 12-year-old and above is 24. And as I stated before, for the next pack, for the next table, there's the pack size, which is different according to age. We have 180 tablets for the first age bracket, 360 for the second one, 540 for the third one, and 720 for the last one. In terms of location, this is still, so it's 12 months for the forecast period, and the location is District X, population 200,000, growth rate 3.2%, and I already stated the number of children. Now, just below, you see the surveillance data. Annual malaria incidence is 18% of the population. The number of children affected between 0 to 12-year-old, it's 7%. It's based on the last 2 years data, so pretty recent. And the malaria incidence for adults is 11%. So there's pretty clear that there's complexity into the population. So the first step into this computation and forecasting is to try to set up the number, the real population. Prospective patients, so adult is 150,300. The children from 0 to 3 is 18. It's in the hypothesis. The 3 to 8-year-old is 25. And the 8 to 12 is 6,700. Yes, exactly. This is stated. Now we compute the incidence rate for adult.
Yeah, sorry, Pierre, one quick second. So because we have the data for the children 0 to 3 until 8 to 12, so the adults we computed by reducing reducing this number
Agree.
from the overall number of 200,000. Okay, so there's no confusion.
And don't be scared by this 1,50 because this is the weird Indian way of computing things. They are the only one on earth using that, so just understand that it's 150,300. No offense, and Sanjay and Andrea.
Yeah, no issues.
So the
This
incidence
is Excel which does it automatically. So sorry.
Incidence rates for adult is 16, so easy to compute. If this is 11% of 150,000. And for children, this is 7% of 18,000, 25,000, 6,700. No big deal into that. Now, what we're trying to do, and then remember that incidence rate for children, line 37, is the sum of the three type of children, which is 0 to 3, 3 to 8, 8 to 12. It's just the summary, okay? Exactly. Thank you, Andrea. So for the total for the total incidence for the existing population is 20,012. Now, what we need to compute as well, because there's a growth rate of 3.2, is the incidence of the new birth. Here, the computation is 7%, because newborn babies are part of the 7%, and it's 3.2% of 200,000, which is roughly below 500 a year. So the real total of prospective patients is therefore new birth and existing population 20,460. I think you follow that. Now what we're trying to move, we move on the right, and we try to work on the regimen. So of course, we start by the adults. Remember that it's 16,533 prospective patients. We said that they need 24 tablets over 3 days. Remember, it was up into the sheet up there. Yes, 24, line 8. Thank you, Andrea. Exactly here. And then, therefore, we multiply 16,000 by 24, and we have less than 400,000. Now we need to divide by the number of pack, because here we are in units, and so we go up the Excel spreadsheet, and we know that line 15, this is 720, because there's 30 in 24 packs. So we divide, therefore, this 400,000 by 720, and we round up, and we end up with 552 packs for adults. Remember, this is for adults. Now we do the same computation, and I guess you understand the logic for the infant 0 to 3-year-old, and we end up with 57 packs. And then we do the same for children, 3 to 8-year-old, almost 60 packs. And then children from 8 to 12, we end up with 16. And I guess in the infant, we add line 38, which is 1,260 plus the newborn babies, 448. That's the reason why you have 1,708. Anything you want to add, Sanjay or Andrea?
No, all good.
Okay.
Yeah.
Now, so that was very simple. we move to forecast number 4.
It was not simple there. So just probably before moving on to the next one, any questions? It may seem very simple, but there are several products with with these kind of weird regimens. So this, like Pierre said initially, this one takes into account 2 different sets of data. Rather, actually, this is 3 different sets of data. One is demographic. So we had the numbers of population, the number of children in different age group. We also had the surveillance data, that what is the incidence rate for malaria. The third set of data is the treatment regimen. Now here we knew the treatment regimen. So Andrea, there is a so we knew the treatment regimen here for this product. So similarly, for any other product, the treatment regimen may differ. It may be easier, or it may be complex. Okay, and in malaria, different products have different regimens. So you can actually use these 3 different sets of data to create your forecasts. You don't need consumption data. So if you see here, there is no consumption data anywhere. Okay, but we still figured out how many packs do we need in 1 year. Okay, over to you, Pierre. And any questions?
Now, ideally, it's always good when you do forecasting to say, now I take a step back. I did my forecasting and I end up with these quantities, and these quantities. Fair enough. If you're smart, you just try to say, does it make sense? And how you able to make sure that it makes sense is you compare with last year's real consumption. And you try to triangulate. If you do that, then you will say, oh, but last year was twice as much. And you try to ask why it was twice as much. There might have been a wet season and therefore way more malaria incidents. That could be a reason. But it's always important to triangulate to make sure that you're not making a mistake. Okay. Let's move to the slides if you're okay with that, and if you don't have any question. Key challenges in the scenario we just discussed is what? There is no consumption data since this is a new product, as Sanjay said, and there is no supply data as well. Can we use the consumption data of the product being substituted? Who would like to answer that? Sanjay, this is the future scenario, or this is the past scenario? This is the past scenario, correct?
For malaria, yes. I think yes, we can, because because of the incidence of malaria. I think we can use consumption data for the product being substituted if it's a malaria program. I think we should use consumption data.
Yeah, but the problem is that it's a new product. What do you compare it with?
You compare with the number of people now, the incidences. I know in terms of formulation, like the prescription, how you take the products might be different. But let's say, for example, I'll give you an example of Zimbabwe. We've got area, the upper side of Zimbabwe, we've got Victoria Falls. That area, there's prevalence of malaria. So we only, let's say 100 people were treated of malaria. Even if we change the product, but because of the consumption data of previous period, we could be able to use it just to make our assumptions.
Exactly. So another example that I would like to share, I was in British Columbia, which is one of the provinces of Canada, and we were introduced a product, a vaccine for cervical cancer, a cancer called HPV. I think you might have heard this vaccine. And then there was an injection on month number 0, an injection 3 months after, and an injection 12 months after. and it was for young girls between 12 to 14, I think, or 10 to 14. And so what we use as a proxy was a similar vaccine with the same schedule and for the same population. And we say, oh, this is the uptake. Okay, so let's assume that it's going to be 80% or 75 uptake. Now, because we will advertise quite a lot on this new product, the Ministry of Health will inform the population. Therefore, there might be some buzz in the news and things like that. So therefore, there might be more uptake. So we use that as a substitute. The best is to have a product that has the same schedule or the same regimen. That is ideal. Now, if it's not ideal, then we will have to use something that is the closest. It's never ideal. And I would say that for this example in British Columbia, Canada, that was super ideal. Now,
Yeah, we lost you. Hello?
One can do only one. We'll have to be extremely creative to use. Yes, Sanjay.
No, we had lost you in between, but it's okay. You're back now. So yeah, so
Okay.
just to summarize your point, and also responding to what Wilson was saying. Wilson, in your scenario, we're not really using the consumption data of the previous product. We're actually deducing the number of patients from the consumption data. So it's actually not really the consumption data. So the answer for this question on screen is that we really can't use consumption data in its own form. So we can't use consumption data directly, but yes, we can deduce the number of patients from the consumption data of the previous product. So that kind of becomes the services data and not the consumption data. Okay. So Pierre, over to you.
Okay.
Hello, Sanjay.
Yeah.
Hello, Sanjay.
Yes.
Yes.
Hello. I'll give a practical example. We used to rely on chloroquine phosphate for malaria as an anti-malaria, and the chloroquine consumption is in the tablets. You could take a lot of tablets. It was then replaced by this quartermeter combination, where the tablets are few. So, like you have said, we like this part of the world, we've got areas that are malaria prone, and almost all the people in that area under a certain period, they contract malaria. So we use the number of people that contracted malaria in the previous year or previous years to then equate it to the new product that is coming in. Obviously, in terms of consumption, they'll be different because, for example, if it was chloroquine, maybe for the full course of chloroquine, you might need, for argument's sake, let's say 21 tablets. But if it was then quartermeter, it's only 3 tablets. But we work with the numbers of people who contracted malaria during the previous period.
Exactly.
Yeah, excellent. Correct.
Okay. Excellent. Thank you for your contribution. Next slide, please. Any question, or you were happy with the back and forth with the participants? Okay.
Yeah, maybe we can move forward.
Scenario number 4. So we here an old-timer Cipro tablet 500 milligram. The pack size is 110 times 10 secondary pack. Indication: typhoid, diarrhea, infection of lower respiratory tract. It is often an essential medicine, no-new target. It's funded by the cost recovery, so therefore the drug revolving fund, and the forecast period is 12 months. As okay. So here, the reason why we propose this scenario number 4 is we would like you to use Excel as expert, super expert, and using the trend function. So let's move on to try to understand how this works. Trend function. So up there's, as you said, as you see, the hypothesis, nothing new. Column number 1, you will see the periods. Number 2, the month. So we have here from January 2017 to December 2018, 2 years. We have the consumption data of CPRO. Column C, column D, we divide by 100. It should have been rounded up, but let's assume that it's fine here. So what we're trying to do is on the bottom to forecast the next 12 months. This is here in pink. And what we're trying to push you to do is to use the trend function. Trend function is actually a function on Excel. There's a little bit of manipulation to do it, and you will have to Control Shift and press Enter so that it's spread over the cell. I don't know if Andrea, you could click on trend and the FX up there so that we understand a little bit how to do a trend function. Can you go up into the bar?
Click on the, yeah, here, exactly.
Here, click here, no, click here, yes. Can you click on trend? And to have the help trend, yeah, click here, click. Okay. Then here you have some kind of explanation. Trend function returns value along a linear trend. It fits a straight line using the method of least squares to the arrays known y's and known x's. Trend returns the y values along the line for the go down, because there's a little bit of manipulation. Down. So we need to, you need, for example, input the formula in the top left cell of the output range, E16 in the example. Then stop. Then press Control Shift Enter to confirm it. And actually you will see the formula will go down automatically. So you need to read that and then practice a bit, but you will see it's no brainer. Okay, you could close this window if you're okay with that. Okay, thank you, Andrea. And then go down the list, please. Yeah. And you will see if you click Control Alt Shift, then the cells line 36 to 47 will be populated, and you will have the trend that is suggested by the 24 months before. So go down, Andrea, sorry. Yeah, and then of course, the number of pack for January to December 2019 is the sum of these 12 cells. And we end up at 1,122 here, rounded up. The way to illustrate this function is to look at the graph. And this is how basically Excel computes it, is that you see in orange the real data, and then Excel will do the trend of this real data. So that means from January 2017 to December 2018, and prolong the trend. And this is what is proposed by the function. So this is the fourth methodology of computing a forecast. This one, you have one data set, which is historical data, historical consumption data. Is there anything you want to add, Sanjay?
Yeah, just going back to the formula for trend. So if you click on so just go to click on the formula. Yes, here exactly. So here there are three things that we need to understand. Like if you saw in the help that we're talking about x-axis and y-axis. So like you saw in the graph. So one is x-axis. In the x-axis, we have the time. In the y-axis, we have the consumption. Okay. Now, if you look at the formula, it says known y's, known x, and what is the new x. So here, if we look at the y is our consumption. So the known y is the consumption that we already have. That is from period 1 to 24, January to December. That is the consumption that we already know. We also know the current X, which is the period between January 2017 to December 18. We've put it in, we've put it in numbers so that it's easier, 1 to 24. That is a known X. Now, what we want to figure out is the new X. That is the forecast between the period 25 to 36. Okay, so this is the new X that we want to figure out. And as we put on this formula, so with known Y and known X's, so the Excel will automatically calculate the consumption for the new X, which is 25 to 36. So we don't have to do anything. Excel will calculate the numbers which are written in pink. Okay, so you don't have to do that. So this is what simply what trend is doing, is creating a trend line for, just like Pierre said, existing data set and then extrapolating it for the number of period that we're, that we want it for. Okay, and based on that, we calculate our forecast. So there are other functions in Excel that can do the same trick, but trend is one of the simpler one that we're showing it here. Okay, here over to you.
Excellent. Thank you very much, Sanjay. Now we move. So basically, we have 4 methodologies. And the next tab is forecast accuracy. Okay, next slide. Next slide. Okay. Before I go further, there's a poll. Which data set is usually used in your country or in your organization to develop forecasts? You have options. You have consumption data, service data. You have combination of consumption and service data, surveillance data, and scenario building. This is the first question. The second question is, have you understood the concept behind using services, demographic, and surveillance data, and when to use them? Yes, you have understood partly, you have understood fully yes, or no, it's still unclear. Thank you. There's only a single choice. Any question before moving forward?
We're still waiting for 2 more people
No question
to vote.
Yes. Finish the poll, please. And the reason why the next tab is very, very interesting is to compare which one of these methodologies which one of this methodology is the most accurate? Still waiting for these people?
Yes, I think
Maybe we can take this slide and also show the results.
yeah, after the end of this slide, I will show the results. We still have 2 more people to vote.
Yeah, one is me, so that's okay.
I mean, 5 of 10 have voted.
Okay. Okay, so probably
Really? Are you multitasking?
Okay, so yeah, one person has not voted.
Who's not responding? Come on.
That's okay. We can close it. We can move it to
Okay,
next.
I'm going to share the results.
Okay, consumption data takes almost 20%, and combination of consumption and service data is the majority, which makes sense. And 2/3 of the people have understood correctly the concepts fully. Do you want to talk about it? Somebody's unclear? Anybody? Or do you want to go back to the Excel spreadsheet when you have more time to dig into them and then sink into them so that you will sink into them? Okay, well, let's move then. Yes. Now we reinforce that services data for services, demographics, and surveillance are always difficult to connect. You know, I graduated from an MBA in Michigan, and then there was a professor of statistics who was taught by a Nobel Prize of Mathematics in the MIT, so Massachusetts Institute of Technology, and this Nobel Prize used to say, "Give me the good data, and I will prove you that God exists." So of course he was being sarcastic. To prove that God exists for the believers. But what I think what is important behind that, behind the joke, is that with data, you could do lots of things. So it's good to spend time on the data, to analyze the data, to know exactly the data, to track the data, to improve the correctness of the data so that you could adjust in an iterative process. Here in this slide, there's the last step, which is to monitor actual data and improve forecast. Exactly what I just said. Forecasts are never correct, but your job, if you are into quantification, is to make it for iterative process, iterative activities to improve the hypothesis year by year, to be able to actually be more and more precise. In this example, no one in 2019 forecasted that in 2020 they will need 1,000 or maybe even more medical gloves because of the pandemic. This is an extreme example to point out that we can never be sure of forecasts, and at some point stockouts and expiries are bound to happen. The question to you is, how do we reduce the occurrence of stock out and expiries and wastage? Here we would like to hear from you guys. Anybody? Okay, then let's move on.
Hello.
Yeah. Yes, sir.
Okay, thank you,
Who's
Mr.
talking?
Hassan. Yeah, it's Abdul Rauf.
Okay.
Yes,
Hello.
Abdul, go
Mr.
on.
Abdul.
Okay. So for me to reduce the occurrence of stock out and spirits, I think the first thing is the monitoring. You know, when you have a forecast for 1 year, you do a forecast for 1 year. I think when you are about 2 or 3 months of your forecast, you have to monitor that forecast that you do to see if it is at the same level or there is something to change about your forecast. So when you monitor your forecast periodically, I think you can reduce the occur of out stock and expiries.
Yes, I think it's a very good suggestion, Mr. Abdul, because that gives you, number one, an evaluation of the past few months. If you said that you need a quarterly update, then you know if you are on the track, you know if you're over consuming and or under consuming, and you're able to make adjustment. If you're making adjustment into your forecast, then it might be a rolling period, and therefore you could order a little more or a little less. And it brings the topic to procurement. It's always nice to have in the procurement process a way to adjust if there is quarterly procurement, then to say, well, sorry, we'll not take you 100% of the forecast. We'll procure 120, or we will procure 80%. Yes, that's a very good suggestion. Anybody else? In the chat, somebody's saying, yes, of course, first in, first out. Something that somebody could suggest is if the prescribers are using the standard treatment protocol, that means that there will be a rational usage. If there is a rational usage, then most likely the consumption will be rational. And if the consumption is rational, it's easier to forecast. So that's the reason why WHO is providing lots of training, and the ministries of health should be focusing on making sure that the prescribers are prescribing in a rational way and not in irrational ways. So that if you're not using historical data, you're using service data, then the forecast is actually aligned with the practice. That's another way. I'm just suggesting. Anybody else?
Yes, I would like to add my point.
Yes.
I think another way we can reduce the occurrence of stock out and expiries is follow closely the consumption data. For example, the stock manager should make sure that they conduct inventory at the end of each month. And in addition, I think some countries have been using automatic software, which can be able to provide some alerts when a product is close of expiration. I think these are some way we can prevent a frequent stock out over.
Yes, very good idea. And I share with you that I visited the 200 health units in British Columbia ordering vaccines, and by providing them with it was not a software, it was an Excel spreadsheet to compute their average monthly consumption. I was able to streamline the ordering, to stabilize a little bit, so there were not peaks and valleys, and it made the consumption way more streamlined, and I was able to forecast better, more precisely. Somebody else talked, and we would like to hear from you.
Hello, for the stock out, especially in this current environment where the global supply chain has been disturbed by COVID. I'll give a practical example, like the Mozambican channel has been affected by a storm. So let's say, for example, it's a vaccine, maybe it's the EPI vaccines, and you have scheduled in such a way that the containers, they arrive maybe after every 6 weeks period. But then there is a challenge of these natural supply chain challenges as a storm. The other way of then preventing a stock out is to always have a buffer stock. Just have a buffer stock. When the supply chain has been affected, you can then cover with that buffer stock while the pipeline normalizes itself. Then in terms of expiries, you also have to look at all the centers, the other centers that have got maybe a lot of product, you can then redistribute to where it is needed. Because sometimes incidences of diseases might be, let's say for example, it's malaria or it's HIV, it might increase in a certain area, maybe due to recent activities. So you can then level the stocks depending on the area from a regional warehouse or a regional holding center.
Exactly. That's very good. That's a very good suggestion. Thank you very much. Who else? Okay, then let's move on if nobody would like to contribute anymore. These are a couple of examples, all of them very good. Sanjay, do you want to elaborate? Can we go back to the slide, Andrea, please?
Yeah, that's okay. That is the next slide. So if you go to the next slide. So now so we are coming to this last portion of forecasting, where we said that when we look at quantification, the last step is to monitor our forecasts and compare them against the actual consumption data. So this is where we talk about forecast accuracy. Now, to understand accuracy, we need to determine error rates. And there are these three ways that you can determine error rates. The first one is mean absolute deviation. The second one is mean squared error. The third one is mean absolute percentage deviation. We'll simply call it MAD, MSE, MAPE. MAD, as you see there, sum of simple mistakes. So it measures the accuracy of the forecast by averaging the alleged error in its absolute, in absolute term. So for example, error in number of packs. Mean squared error is again in number of packs, but then we are squaring that value. So it is a technique just to show where the error rate is high, because it will just amplify the error so that you know that in this particular place the error is high. Percentage is more useful where it is difficult to tell the unit. So for example, in the example if you see here, if you tell your manager that, oh, we were off by 3,000 tablets, but 3,000 tablets out of what? So that becomes very difficult to understand for someone. But if you say that we were off by 4%, then it's quite easy to understand, even if you don't know the denominator. Okay, so that's the use of percentage. Okay, so in the Excel, we show these three methods of how you can determine forecast accuracy. Okay, so Pierre, do you want me to just take over, do this?
Yeah, okay.
Okay, all right. So if you see here, so what we're going to do is we're going to take the first scenario of ciprofloxacin and then compare the forecast that we developed using AMC, compare it against the fourth one, which we developed using trend. Okay, so we'll compare these two forecasts. So the first one, again, using AMC, which is forecast 1. So we arrived at the forecast of 1102 packs, while in the forecast number 4, we arrived at number of packs 1122. In column F, this is again hypothetical situation of actual consumption month-wise for those months. Now that is 1133. Now we will see again month-wise what is the error rate in each month and how do we depict error rates in those 3 ways that we discussed: MAD, MSE, and MAPE, mean absolute percentage error. Most easy to understand is the percentage error, and that's why you see that being highlighted in green. Now to determine mean absolute deviation is simply to subtract. Okay, so first of all, we are determining the mean absolute deviation for the forecast, which we developed using the AMC calculation. If you see on top, it says AMC. Okay, so for determining the error rates in the AMC calculation, what we do is we subtract F9, which is the actual consumption, by the AMC forecast. Okay, so we come up to 3.8 and we use a function called ABS, absolute, so that it does not go into negative. Well, otherwise, if we do 88 minus 92, it will become minus 4 or minus 3.8. So when we use this function of ABS, it comes back with a positive output all the time. So that's why you're using ABS. So it's an absolute deviation. We're not talking about minus or plus. Okay, so we do this for all of them, and then we take an average. So if you so if you do the average of all these, then we get the mean absolute deviation. So the mean absolute deviation for this entire AMC, for the forecast developed using AMC, is 5.98. Okay, now to understand where the error is more high, so if you see here in some in MSE calculation, if you want to do the MSE calculation, what we need to do is just square the absolute deviation number. So it's the square of 3.8, 14.44, square of 3.2, 10.24. So if you see here, the higher the number, the more the error. So 174, it's quite high as compared to 0.04. So if you see in the numbers, in that particular month, May, the consumption, April, the consumption and the forecast were the same, 92. There was some percentages error. But if you look at the month October, the forecast is 92, while the consumption is 105. There is a very high rate of error. Okay, so it's the squared error for each of these values. Now MSE is mean squared error. So again, we take the average of all these and we come to 50.42. That's the mean squared error. Now to understand the percentage error, so if you go to K9, yeah. So to understand the percentage error, we divide your mean absolute deviation, which is MAD, by the actual consumption. So 3.8 divided by 88 into percentage is 4%. That's a 4% error. Similarly, we determine the error for all of them. And again, we take a mean. Okay, so it becomes 6.25. So 6.25 is overall the mean absolute percentage error when calculating the forecast using the average monthly consumption method. We do the same calculations for the second method, which is trend. Go to the right, slightly right, go right, go right. Yeah. So again, we determine MAD, MSE, MAPE, do the means, take the average. And we see here that the error rate in this particular case, when using the trend function, is 5.55%. So in this particular case, if we do the forecasting using trend, it is giving us better results. Now, this does not mean that if you always use trend, it will give you better results than AMC. This is only in this particular example. But you would not know that unless you do this exercise. So whenever you have a forecast with you and you have actual consumption, you do these calculations and you will know how accurate or not accurate your forecast is. Okay. So this is how you figure out your error rates and you understand your forecast accuracy.
Andrea, so to compare AMC, so average monthly consumption methodology and trend methodology, Andrea, can you divide 5.55 by 625 minus 1, please? So that we'll see that in this example, how much better is the function trend compared to AMC, minus 1.
Sorry, hold on.
No, it's good. Yeah. No, it's good. It's good. So that means that if we contrast 555 to 625, 55 is 11% better than 625. So actually in this example, the function trend will improve your accuracy by 11%, which is not bad. If after this class, you're able in your own setting and in your own organization to use the function trend, to use more sophistication into your forecasting, and you're able to improve by 11%, then you will have done a good job because you saves lives probably and thousands of dollars. Back to you, Sanjay.
We go back to the presentation very quickly. Yeah, next. Okay, excellent. So this was a very quick and I would say still easy way of determining forecasts and also their accuracies. You also have all this information in your learning materials on the platform. This slide and this video will also be shared in the platform. But before we go off today, please also rate this session. It will be very helpful. But again, the idea for today's session was to give you the basic methodologies on how forecasting is done. This is not to make you an expert in forecasting. That's probably a full course in itself. And also, you don't need to become an expert in forecasting when you have so many softwares working for you. What you need to understand is that you need quality data. You need to be able to triangulate the forecasts, and you need to monitor the forecasts as you go on. Okay, so those are the three things that you need to understand. When you work in forecasting or you coordinate with people who do forecasting. So if you're working in procurement, you can ask your forecasting team, okay, so what is the error rate in the forecast? If they're clueless, then that means they need to join this course. Okay, so that was today's session. The next week we will be learning more on procurement, but please, whoever has not finished week 1, please do that very quickly so that you can come to week 2. And then next week we will move over to procurement, which is the next step in any supply chain. By week 2, you should be able to understand demand estimation, supply planning. Once supply planning is done, then we go over to procurement. Okay, so thank you very much. Thank you, Pierre. Thank you, Andrea, and thank you everyone for joining us.
Thank you all.
Yeah, this video and slide will be uploaded and sent over to you as well. Thank you so much.
Yeah.
Have a good day, good week, and we'll see you soon.
Thank you. Bye-bye.
Bye-bye.